Welcome to our comprehensive exploration of somatic symptom and related disorders, a group of psychological conditions that highlight the profound connection between mind and body. In today's video, we'll delve into these fascinating and often misunderstood disorders, examining their characteristics, diagnosis, treatment approaches, and the latest research in this field. At their core, somatic symptom and related disorders involve physical symptoms that cause significant distress and impairment in daily functioning. What distinguishes these disorders is not necessarily the physical symptoms themselves, but rather how individuals experience, perceive, and respond to these symptoms. The hallmark feature is excessive thoughts, feelings, or behaviors related to these somatic symptoms or associated health concerns. Let's begin with somatic symptom disorder, the most common condition in this category. Individuals with this disorder experience one or more chronic somatic symptoms that they find distressing or result in significant disruption of daily life. What's crucial to understand is that these physical symptoms may or may not be associated with another medical condition. The defining characteristic is the disproportionate and persistent thoughts about the seriousness of one's symptoms, persistently high anxiety about health or symptoms, or excessive time and energy devoted to these symptoms or health concerns. Illness anxiety disorder, formerly known as hypochondriasis, represents another important condition in this category. Here, the individual is preoccupied with having or acquiring a serious illness, even in the absence of significant somatic symptoms. They experience high levels of anxiety about health and are easily alarmed about personal health status. These individuals frequently check their bodies for signs of illness, seek repeated medical consultations, or conversely, avoid medical care due to fear of discovering a serious illness. The preoccupation persists despite appropriate medical evaluation and reassurance. Conversion disorder, or functional neurological symptom disorder, presents with symptoms affecting voluntary motor or sensory function that suggest a neurological or medical condition. Common manifestations include weakness or paralysis, abnormal movement, swallowing difficulties, seizures, sensory disturbance, or even apparent unconsciousness. Importantly, these symptoms cannot be fully explained by a neurological or medical condition, and they are not feigned or intentionally produced. Psychological factors are often identified as being associated with the symptoms, as they typically emerge in the context of extreme stress or trauma. Another condition worth highlighting is psychological factors affecting other medical conditions. This disorder involves behavioral or psychological factors that adversely affect a medical condition. These factors might include psychological stress delaying recovery from surgery, denial of symptoms leading to poor adherence to medical advice, or anxiety exacerbating conditions like asthma or hypertension. The impact of these psychological factors on the medical condition can vary from minor to life-threatening. Factitious disorder represents a particularly complex condition in this spectrum, characterized by the falsification of physical or psychological symptoms in oneself or others, in the absence of obvious external rewards. In factitious disorder imposed on self, individuals misrepresent their history, falsify medical records, or actively induce illness by various means. The more severe manifestation, factitious disorder imposed on another, previously known as Munchausen syndrome by proxy, involves the deception of others by falsifying illness in another person, most often a child, elderly individual, or someone under the perpetrator's care. What factors contribute to the development of these disorders? Research points to a complex interplay of genetic vulnerability, neurobiological factors, early childhood experiences, personality traits, and learned behaviors. Individuals with these disorders often have heightened sensitivity to bodily sensations, difficulty regulating emotional distress, and may have experienced childhood trauma or witnessed illness in family members. Cultural factors also significantly influence how somatic symptoms are experienced, interpreted, and presented. Diagnosis of somatic symptom and related disorders requires careful assessment by healthcare professionals. This typically involves a thorough medical evaluation to rule out other potential causes of symptoms, psychological assessment, and consideration of the duration and impact of symptoms. Healthcare providers must approach this process with sensitivity, as patients often feel dismissed or misunderstood when their physical symptoms are linked to psychological factors. Treatment approaches for these disorders are most effective when they acknowledge both the physical symptoms and the psychological distress they cause. Cognitive behavioral therapy has shown particular promise, helping individuals identify and modify unhelpful thoughts and behaviors related to their symptoms. Other effective interventions include mindfulness-based therapies, which improve awareness and acceptance of bodily sensations without catastrophic interpretations, and psychodynamic approaches that explore underlying emotional conflicts. The doctor-patient relationship plays a crucial role in managing these conditions. Regular, scheduled appointments with the same healthcare provider can reduce emergency visits and unnecessary tests. Validating the patient's suffering while gradually shifting focus from symptom elimination to improved functioning represents a balanced approach that respects the reality of the patient's experience while promoting recovery. Recent advances in neuroimaging have revealed fascinating insights into these disorders, showing alterations in brain circuits involved in sensory processing, emotional awareness, and cognitive control. These findings challenge outdated notions that these conditions are all in the head and instead point to complex neurobiological mechanisms that bridge mind and body processes. As we conclude our exploration of somatic symptom and related disorders, it's important to emphasize that these conditions represent genuine suffering that deserves compassionate care. By increasing awareness and understanding of these disorders, we can help reduce stigma and improve outcomes for those affected. The mind-body connection illustrated by these disorders reminds us that holistic approaches to healthcare, ones that address both physical and psychological well-being, are essential for optimal human health. Thank you for joining us in this important discussion.